I'd like to introduce Dr. Shishir Prasad ji, MS Shalya Tantra and Marma Therapy Specialist and Senior Consultant from Uttarakhand Ayurveda University. Expert in Marma Chikitsa and Kshara Sutra Therapy for anorectal diseases. Yeah, sir is here and sir is going to give some useful information on Marma Chikitsa.
Shri, thank you, Dr. Satyadeva. It's a great honor for me to be present. Yeah. Hello. Can you hear? Is it okay? Right. So it's a great honor for me to be here and speaking in this wonderful Swasthya Expo. And my topic to talk today is Marma Chikitsa and its global outreach, of course, and then the clinical applications, how we do it and how even a common person can do on their own. So next slide. Okay. One moment. This is a case of, fine. Marma therapy in secondary frozen shoulder. You can see the range of movement of the patient, the shoulder joint, and also the facial expression of pain on the patient's face. This was treated in Mexico in Cancun, and he's a German guy. He had this problem for 6 months, and then he thought that he would not get improved in the shoulder joint range of movement. And then the same patient, immediately after doing the Marma therapy, as you can see, the degree or the range of movement increased by 30 degrees and the pain decreased by 40%, right? So this is a case which I treated in Cancun, and this is after the first setting of Marma therapy. So what I did was, I could not stay for very long in Mexico, so what I did was ask the patient to do it on himself, and this patient followed it up very well, and for almost 1.5 months. So I asked after that the patient to send a video again, and after 1.5 months you can see the video. Oh, one second back. Can you click on the video? Click on the photograph. No. Next. Click on the photograph. Yeah. So the patient did some of the Ayurvedic medicines along with it, but this patient I did not. So and is very happy, and it's already been almost more than 7-8 years now, and even now he is absolutely fine. He's now, although he's not in Mexico. This was in Germany, in Berlin. This lady came from Switzerland when I was in Berlin, and this was treated for almost 3 years, this lady, and although she had gone through many best universities and also to physiotherapy department and other places, but still she was not quite satisfied with the treatment. Although it did improve, it's not like it didn't improve, but she was still unsatisfied. And so you can see the range of movement of the shoulder joint before in the first picture, and then the same range of movement immediately after doing the Marma therapy. Again, the degree is improved by around 25 to 30 degrees on the same day. And this is another one, the downward picture that you can see. On the same day, the range of movement has improved. This was a case in Singapore, and this patient was a case of hemiparesis. He had already had a CVA, but he survived, and ultimately he did get some problems in the one side of the shoulder joint as well as in the lower limb. So, no, first that one please. Yeah. So you can see the video now. Okay. So you can see the video, the range of movement of the shoulder joint, right? And the same patient after doing the Marma therapy, this is actually in the hotel room where I was staying in Singapore. So the next video, please kick, right? Yeah, the next one, yes. So now you can see the range of movement and compare it. So that even in such case, the range of movement of the patient's shoulder joint improved, right? And he was quite happy with it. This is a case of macular edema, although it's not my topic of talk today, but still I'm sharing one just to show you on the objective parameter. What happened was a patient from Italy when I was in Cagliari. So he came there and was attending one of my workshops. So this patient told me that, see, I have such and such problem, what to do? So I said, you see, I have done only 2-3 cases at that time, so I cannot promise that I will be able to treat such cases, and of course I am not an eye specialist. So when I do discuss all these cases, I do discuss with my wife, who is a Shalakya specialist, right? So anyway, so I told him, see, I cannot promise you based on only 3 cases that I have had so far. That was around 4 years back. So he said, no, I still want to do, right? So I said, okay, yeah, if you want to do, then I can tell you what are the points that you can do. So he did it, and after 4 months I again went. That was in, I think, 2019 June that I was there in Italy, and then again after 4 or 5 months I was there. So he came to pick me up at the airport, and his vision had improved, and in the objective parameter also he showed me the OCT, and in the OCT you can say that the edema had reduced, and this patient had already taken around 5 injections for the eye, but later on it's already been 4 years since then. He has not needed to take any injections. Of course, some of the Ayurvedic medicines, the simple ones like Trifla Jal Netra Prachalan, and a couple of Ayurvedic medicine was told to him, right? So we had very good results in this. So far I have only 7 such cases. This is a case of lumbar canal stenosis. We have had many cases of lumbar back pain treated through Marma therapy, and this case is not mine. This is one of my students, Dr. Hiren Mistry, who is doing PhD in Jamnagar, Gujarat Ayurveda University, and he treated this patient for 1.5 years, and in the MRI also you see that in the first line there, the AP diameter is 4.6 mm as shown, and after 1.5 years it increased to 6.5 mm, that is the compression decreased, and it is on the objective parameter. Also in the report it is showing there that there is a regression in compression element over left exiting nerve roots at L4-5, right? So this is what the MRI says, and regression in compression over thecal sac and D12, L1 and L3, L4 levels. So on objective parameters also. We have been to many places. This is in the United Nations headquarters. There's an organization called World Association of Former United Nations Interns and Fellows. So I was invited there by the scientists there, Professor Valdemar Prado, who was a professor in Stanford University for 24 years, the biomedical scientist, and we had good discussions there. And this is in University of Cologne in the nanotechnology department. We had some good sessions of Marma therapy. Then this is in Israel, where in the Indian embassy we conducted a few workshops. This is a few times in Israel already. So this is in Tel Hashomer Hospital in Israel. This is a government hospital and is one of the best in the world. And it's in the complementary medicine department. So I was asked to make a presentation on PTSD, that is post-trauma stress disorder. And when I was just going to open my PPT and show it, the presentation to all, what the director there told me that, Dr. Prasad, can you show it on a patient? So I said, okay, bring the patient. So they brought a patient there. I asked a brief history of the patient, what happened. Actually, what had happened was a terrorist had tried to slit his throat, but he survived. He had a gunshot injury in the calcaneum bone. That was the bullet was still there in the calcaneum, so he did have some walking difficulty. And actually, when he came inside and we could saw his walk, and I realized that not only the PTSD, that he has all those dreams and all the symptoms of PTSD, but he also have this low back associated with it. And he did say that he has those problems. So then I said, okay, I will do the Marmas for the low back pain first now. So everybody was watching there. There were some of the best psychologists of Israel, the acupuncture and acupressure specialists, the homeopath specialists. There were different field faculty, doctors were there. And I did the Marma therapy, and after doing it, when the patient walked and they took the feedback from the patient said that he feels that he can put more weight on the limb now, right? So they were quite impressed. And this is an Indian Embassy in Hague, in Netherlands. There are many doctors, including the super specialists from allopathic field. This is in Poznan. The doctor who had invited is an ophthalmologist, and her husband is the phlebologist. So this is in NARTC, Government of Nepal. In Nepal, there are around 450 medical officers and around 1,500 paramedics. So we are training all the government medical officers of Nepal in the science of Marma, and also the paramedics. So we have already trained 5 groups of 30 doctors, around 30 paramedics, and they are training the other ones. So all the doctors of government of Nepal will be trained into Marma science. These are some of the feedbacks of the patients of stress anxiety in Portugal, where I was recently. So I'm going to skip this. This was in Australia, and with the consul generals of one in Perth and in Melbourne, the Australian Association. This was in Mexico, and around 1,200 people in Mexico from 25 countries attended this workshop. So this is in Cagliari, Italy, and many other places. This is in Portugal. So we have been following this world over, and yeah. So this was a Brazilian group in India, basically in Rishikesh, and this is another group in Rishikesh. So this is another case of frozen shoulder. So I'm just going to skip these videos and come directly to what we do actually. We'll come to that. This is another case of feedback of tennis literature there, right? And then in Ayurveda, also in Ayurvedic texts, there's a lot of description about the marmas in Sushruta Samhita. Charak also, although Charak defined more about the 3 of the basic important marmas, where you have the whole chapter of Trimarmiya Adhyay. And however, Charak did not explain about all the 107, and Sushruta was the first to explain about all the 107 marmam and their anatomical positions and so on, and the classification also. So if you see the genesis of Marma, then it is written that Mum Ranin Jeev Sthane Sandhi Sthane Tatparich. Ma means Pran or Vayu, and Raftali, it's an energy healing sign. So what I'm going to do is first explain about some of the energy concepts. We all know that we emit certain kind of energy radiations. It's just that we cannot visualize it. Some people can do, some people in theosophy also can visualize the energy field, but not everyone can see that energy field. So what Professor Korotkov and the team did was they designed a camera, which is called as the Karelian camera, and mapped the invisible spectrum of rays and converted the invisible spectrum into the visible spectrum of rays, right? So this is the experiment where what they did was the first drop, the glow is dramatic. The biocharged water has more than 30 times stronger aura, vibration, and significantly altered physical and biological properties, right? So if you can change the energy field of water, you can also change human bioenergy field, because we are from 70% water molecule. And this has been used, this experiment has been used very widely in different researchers. Now you have like whole university based on energy science. There was one research in Brazil carried by Milton Holmes and Professor Bunzon. So what they did was they mapped the energy field of the fingertips of patients of cancer at different stages, different types of cancer, and they did a graph. Like, okay, so after that, any other even young patient they can map the energy field of the patient and compare it with the graph and predict that this person, he or she, can have that type of cancer after 3 years or 4 years. So this is just to tell you one of the application of this energy science here, this experiment by Professor Korotkov. And the best part is Professor Korotkov has mentioned that he has taken use your own hand to do the the stimulation of the Marma points. I will be choosing some of the diseases specifically and tell you which are the Marma points that we did and how you can do it. Okay. So you can close this one and open another one. We include in those cases of secondary frozen shoulder who are not responding to these 4 Marma point stimulation. Most of them will respond to these 4. Out of these 4, we need, for cervical spondylitis, we can stimulate only 3, that is the Ans, the Kurper and the Chipper. However, if the patient of cervical spondylitis or spondylosis, the patient is radiating towards the occipital region, then we will need to include one more, that is the Krikatika Marma. Right? So even though we are talking about these 4 specifically for one of the diseases here, the same Marma point can be used in other aspects or other diseases as well. Like suppose if you wake up in the morning and get a stiff neck, only 2 Marma points, that is the Ans and the Kurper, is fine. You don't need to take any painkiller or muscle relaxant to relieve that neck sprain. Right? A few times, 3 to 4 times is sufficient. In cases of tennis elbow or golfer's elbow, we do 3 Marmas, that is the Ani, the Kurper and the Indrabasti. So if it is a case of tennis elbow, which is a lateral epicondylitis, so we do the Ani, the lateral aspect of the Kurper Marma and the Indrabasti. If it's the case of golfer's elbow, then we do the Ani and the medial aspect of the Kurper Marma and the Indrabasti. So now coming to the Marma point location. So Ans is a Snayu or a Vaikallikar Marma. There are 5 types of Marma we know Mans, Snayu, Asti Sandhi, and also Sadhya Pranahar, Kalanta Pranahar, Vishalagna, Vaikallikar and Rujakar. So this is a case of Snayu or a ligamentous or tendinous Marma. So we have to remember when we are doing the Marma therapy, what type of Marma we are stimulating. In cases that the Marmas are vascular in nature, that is Sira Marma, we have to be very gentle in the application of pressure that we are doing. In the other 4 types, the application of pressure can be variable. It can be moderate pressure, but in case of Sira Marma or the vascular Marma, it has to be very, very gentle, and sometimes it's only a matter of touch rather than a pressure at all. So the site of this is around this, on the trapezius muscle, where you have shown the arrow. So that is the site of the stimulation, and I'm going to show you here. Basically, what you do is from the nape of the neck, where the neck joins the shoulder, you go 2 finger breadths behind, okay, and do the stimulation of the Ans Marm with 2 fingers, that is the index finger and the middle finger. There is a video for this. Okay, click on the video. Elbow, keep your elbow close to the chest, and from the mid axillary line make approximately 30 degrees angle, and use your 2 fingers and it goes in the back like this, right? And then it moves slightly inwards, and then it moves slightly inwards here, and then apply the pressure like this. The other fingers are kept closed like this. You keep the other fingers closed so that you don't touch any other organ or in this place, right? So you keep it closed and use only this, like here. Don't raise your elbow upwards. So if you raise your elbow upwards, then you can go further backwards. It is okay to go slightly backwards and downwards, but don't go too close to the neck. If you go too close to the neck, sometimes there can be giddiness or dizziness like feeling, especially if you are doing it in the cases like more sensitive people, right? So so that way what you can do is just sit here, close it, and then stimulate, right? One by one. So this is the way you do the Ans Marma stimulation. Now the next one is the Kakshadhar Marma, and 2 points, one on each shoulder. So it is a Snayu or a Vaikallikar Marma. Its size is 1 angle, and the location is 2 finger breadths inferomedially to the acromioclavicular joint, right, anteriorly. So as you can see in this figure, so this point here is the, don't go down further because you have the brachial plexus there, right? So it is okay. Suppose if you are going 1.5 finger breadths down from the acromioclavicular joint, it is okay, but don't go further down. You don't want to cause any injury on the brachial plexus. Now, once you have identified the Marma point, then what you need to do is know the stimulation technique, of course. So you can just place, if you are doing it on a patient, you just place your forefingers in the back and use the pulp of the thumb to do the stimulation. The direction of pressure is, in this case, from the point of stimulation approximately 45 degrees upwards and slightly outwards. So the feel that you will have on your fingertip is the feel of the bony contour of the head of the humerus. If you are having a more softer feel on the thumb, then that means you are more on the brachial plexus area or more of the vascular area, right? So the feel that you will have on the thumb is more of the, especially on the lateral side of the thumb, will be more of the bony contour of the humerus, not the softer one, right? So keep that in mind, please, before you do the stimulation. From this point, we have to go approximately 1.5 finger breadths below. So this is how we do the 2 finger breaths that I was saying. This, as I was showing here, you go inferior medially again. From this point, you go approximately 1.5 finger breaths below. So this will be the side of the. Okay. So now we have located the site. Here also, you will have the deltopectoral. Use the pulp of the thumb here and then apply the pressure from this toward the imaginary midpoint in the posterior line, right? So this is how we will be. And of course, when you are doing it, your elbows should be slightly flexed. Because when the elbows are slightly flexed, then you can more better stimulate, because when you're doing the Marma point stimulation, you need to be more relaxed, right? So the elbow needs to be slightly flexed, not completely extended. So this is the Ani Marma, and again you can do 20 to 25 times. All these Marma which I am talking now, you can do 20 to 25 times in one sitting, 2 to 3 times in a day. Intermittent stimulation, it's not a continuous pressure. So now coming to the next one, which is the Kurpar Marma, and the Kurpar Marma, I will just go on explain from the figure here itself, is the point of stimulation is on 2 sides, both on the medial as well as on the lateral aspect, right? So you can identify this through this figure as you have, first of all, you draw an elbow crease, right? And then you go 1 finger breadth down from the elbow crease, and from the anterior midline, and if you draw a straight anterior midline, you go 3 finger breadths medially, right? So this is how. So what you see here is stomach. However, if the patient is diabetic, then don't do it completely empty stomach. The patient should. So if the patient is diabetic, better ask the patient to lie in the supine position and then do it, right? Otherwise, you can do both in sitting position as well as in supine position, the same Marma point. However, the patients are more sensitive, diabetic, better do it in the patient in the supine position. Sometimes there can be nausea and vomiting like feeling when you do this stimulation. Sometimes there can also be like slight giddiness. If that happens, and that is actually that may happen when you are doing in the initial phases and the patient is in the sitting position. So better you ask your patient to do in the supine position and then do the stimulation. Then you avoid that kind of simple complications that can happen. Okay, so now once you have identified the point, so what you do is, and of course you have to do this stimulation. So if you're doing the self Marma therapy, then you can place your forefingers in the back and use the pulp of the thumb here, like this, right? So you can do it here and make an imaginary line from this point towards the olecranon. So this is the bony prominence that you feel is the olecranon, and you make an imaginary line from here to this point and apply intermittent pressure like this. Okay. keep the elbow flexed and the palm should be facing upwards. If the palm facing downward and then you're trying to stimulate, then you will not be able to find the exact location. So it's important how you place your palm, right? So again, like this. Also, in some cases, there can be some burps. That is okay, right? So you have to tell the patient beforehand. You can apply up to 6 pound pressure in this area. Now, the next question yours will be how to measure 6 pound or 4 pounds or 2 pounds or 1 pound, right? So it's very, very simple, very easy. Even in the beginning of my phase, I used to think, okay, pressure, how much, how to measure it, something very difficult. How will I get that instrument to find out, right? So what I thought was very simple. You have kitchen weighing scale, right? You apply pressure on the weighing scale in the kitchen that everyone has nowadays, and measure what is the pressure, because it's not the exact pressure. You can do around 5, 6, 4, in between 4 to 6 pound pressure that you can apply. It's not an exact amount of pressure that you have to apply. So you can easily measure the amount of pressure that you are giving with the help of the weighing scale, and see what is the reading is coming, and apply the same pressure on the side. It's quite easy. Sira Marma, generally we apply 1 to 2 pound pressure, sometimes even lesser. Better start with only 1 pound. Suppose, for example, the Apanga Marma is a Sira Marma, so we apply very gentle pressure on the side. In the upper limb, you have only 2 Marmas, which are Sira Marma. That is the Bahvi and the Lohitaksha. Those are the 2 only which are Sira Marma. The others are non-vascular Marmas. Right? So this is how you can do. If you can apply on this side, on the Ansa Marma, approximately 6 to 8 pound pressure. Right? So the pressure varies from Marma point to Marma point, even though if the type is the same, like for example, the same can be same Snayu, or it can be same Sandhi Marma, but the pressure can vary from Marma site to Marma site. Generally speaking, the amount of pressure on Sira Marma is much lesser. On and put the 2 fingers here like that, and then again elbow needs to be slightly flexed, and then the direction of pressure is towards the olecranon. See, if you are able to find the point correctly, but if you are applying the pressure in the forward direction or in the downward direction in this way, we have seen that we have not got enough good results. And this is, some of them have come out through clinical observations, and some patients we did, and then patients said, sir, when you are doing it here, I was not getting any relief, and when you did it that way, we got better. So some of the observations that we had, and then we use on thousands of patients. So this is how the Kurpa Marma can be, is apply the pressure directly downwards. But if you do the pressure slightly towards the thumb, then the effect is better. So what we do is place the index finger on the thenar eminence, and there are certain references which says that the Chipper Marma is not only on the dorsal aspect but also on the palmar aspect. So when you are putting the index finger like a thumb and pushing it or placing it in the thenar eminence, so and then doing the stimulation, what you are doing is taking care of both sides of the stimulation of the Chipper Marma at the same time. So you place this index finger here, and the thumb goes here, so slightly towards the thumb. So this is how we will do the stimulation of the Chipper Marma, again 20 to 25 times in one sitting, 2 to 3 times in a day. Now I'm going to close this presentation, and I'm going to show you some more points for low back pain, because this is another very common problem, and I'll be fast in doing this description. Right? To start doing the Marma, it won't work, right? So then you have to be careful, and whom you have doing the Marma, right? So the type is a Sandhi Marma, and is a Vakalekar Marma. These numbers are 2. The size is Ardhangal. So the point or the method of identification is near the posterior superior iliac joint, right? You can feel the bone projection here, and the point just near that you have a site depression, and that is the site of stimulation of the Kokundar Marma. Okay, so basically it lies, so you can see projection. Hello. So yeah, So this is the posterior superior iliac spine. So around this site here, just what you have to do is feel this bony projection, and around this site will be the site of stimulation for the Kokundar Marma, and the Katika Taranam will be just superolateral to the greater trochanter. So this is the greater trochanter, this is the lesser trochanter, and you have to be on this site here, around here, to do the stimulation, right? So this again in the figure, that the green point that you see is the posterior superior iliac spine, right? And just medial to that, the depression area. You don't have to press on the bony projection. You have to press on the medial, on the depression area, rather than directly on the bone. Now there's a specific method of stimulation for this Katikadharana Marma, superolateral to the greater trochanter, I said, around this area. So what we do is, instead of directly pressing downwards, in this case, we go from lateral to medial, right? The reason being, you have the sciatic nerve, which is crossing around this area from this point, and you have the great sciatic notch, as you can see. Of course, when you are at the right point, you will not injure it, right? But sometimes when you go more medial, then and you're going quite deep, so you can injure the sciatic. So the approach for the stimulation of the Katikadharana will be from the lateral to the medial aspect, instead of pressuring directly downwards. This is a video that I'm going to click for Kokundar Marma. So better done when the patient is in the prone position, right? So at this case, the patient is in the prone position, right? The first figure that you saw in the sitting position, that was just to identify and locate where the point is. If you're doing it on yourself, then what you also do is you can just place your thumb or finger on the iliac crest, right? So you can place your finger on the iliac crest, as you shown here also. It is on the iliac crest. So you place the index finger on the iliac crest and put the thumb back, right? So you will reach the exactly right position. So the both ways, both hands. You can use like. Even sometimes when you get tired, and then you put your pressure and then you exert like this. So unknowingly you are stimulating the marma, right? So this is how you do the stimulation. And the direction of pressure is directly downwards and slightly outwards. Don't go medially. We don't want to cause any injury on the spinal nerves that are coming out of it, right? So go downwards and slightly outwards. From the midpoint, posterior, it will be 2.5 fingers to 3 finger breadths on the outer side. So the position will be in the L4-5, because or corresponding to L4-5, because when the iliac crest corresponds with L4. Right, so the iliac crest corresponds with L4, and the posterior superior iliac spine around the L4-5. So you place your finger here and then do the stimulation. So use the pulp of the thumb. Sometimes some people use elbow, but I don't advise. For personally, there are people who can get good benefits out of it. But for personally, I don't advise to use the elbow, because you may tend to exert extra pressure when you use the elbow. Just use the thumb, and that is sufficient to do the stimulation. Better do it when the patient is in the empty stomach. Okay, so this was the Kokundar. I'm going to skip now. So now coming to the Katika Tarana, this is Asthi or Kalantar Marma. The size of the Ardhangul, the numbers are 2. So just if you can flex your knee and lie in the prone position, the point at which your hip, the heel touches the back, that becomes the site of stimulation for the Katika Tarana Marma. And when for self-stimulation, you can just sit in Vajrasana, and then the marma gets a stimulation. However, when you sit in Vajrasana, what happens is your heel tends to move on the outer side, right? So what happens is when you're putting it like this, then the heel goes outside. So when you want to stimulate the marma specifically, keep the heel consciously touching the hip area. But not everyone can flex the knees completely, right? So in that case, you just identify the greater trochanter area. I will see the next video, I will show you. So yeah. So here you have to identify the bony landmark, and just go slightly superior to this when you are in the position is the patient is in the prone position, slightly superior, and make an imaginary line toward the pubic symphysis, and then with the help of the thumb, the two thumbs, the exert the pressure towards the pubic symphysis. This is just for identifying where the location of the Marma site will be. See, out for low back pain, I've sent 5 points. Out of these 5, if you are using 4 points for osteoarthritis knee, like Indrabasti, Golf and Shipper, and include the Janu Marma. So we have had good results in cases of osteoarthritis knee. Even in rheumatoid arthritis, we can use the same Marma points: the Janu, the Indrabasti, the Golf, and the Chepra. In case of low back pain, again, even if you are not able to do these two, even if you do only the 3, that is the Indrabasti, Golf and Chipper. Sometimes if we have many patients in the OPD, we are not able to do all the 5. Even if you do 3, that is the Indrabasti, Golf and Chipper, even then you get good results. If the patient is in the IPD, then of course better that you do all the 5. You understand, you think like it is a vascular Marma, so the pressure will be very gentle, like 1 to 2 pound max, right? So if you are doing it from the posterior approach, initially in your practice, I say that better start with the anterior approach, don't go directly on the posterior approch, right? So this is the anterior approach, and you can use the two thenar eminences, but the distance between the two thenar eminences, these say this is how I'm doing it. This was a case in Poland. He's a physiotherapist. He came to India, stayed with us for 3 months, and then he learned, and then is practicing physiotherapist also with Marma. So you can see, it is sometimes better if the leg or the knee is slightly flexed rather than completely extended. So now if you have to do this self, again you see, on the boundary of the popliteal fossa, on the boundary of the patella, you have to place the thenar eminence and then do the stimulation, okay? Now the Indrabasti stimulation, or the point of the Marma is actually this side, right? However, do not stimulate exactly at the point where the classical references would say that this is the point of the Indrabasti Marma, but because clinically we have seen if you do that, there are chances of hematoma formation, right? So you go 2 finger breadths down, right? So what you do is from the sole of foot, you measure 12 finger breadths, and when you are measuring this, the patient has to be in the anatomical position, that is the ankle has to be kept at 90 degree, right? It is not to be hyperextended, not to be hyperflexed. If to be at 90 degree. In this case, in the figure, as you can see, the foot is 90 degree, hyperextended. So if you measure from this way 12 finger breadths, you will go above. So you have to place the foot at 90 degree and then measure from the sole of foot here the 12 finger breadths, and then you will be able to identify the Marma site correctly. And once you have identified the Marma site, then you can use the 2 thumbs. The direction of pressure is directly downwards. Again, the intermittent pressure, not a continuous one. Technique for all the patients. What I say is the technique remains the same, but you can vary the Marma point to Marma point. The next question from her is how we decide which Marma to be selected. So that for the time being, I have given you a certain protocol, but the Marma points, you also find references, like for example, the Ansa Marma is said to affect the Udana Vata, like Chipra Marma is said to affect the Prana and Vyana Vata. So now you decide which one is the effect, which of the doshas that you want to influence more, and then based on that you can change. Like for example, the same Marma can also be done in bronchitis patients. Right? I'm doing in cervical, but it can also be done in bronchitis patients, and I've done it. Right? So the number, how you will select, it depends upon, and also not only that, there are also certain references. The Marma point affects which srotas or which channel systems. So based on that, also you can decide. Right?
How many days we can continue, sir?
After the first instance as well, you get improvement in the patient. That is the benefit of it. To sustain the effect, you will need to do multiple times in such cases. Like in that, in secondary frozen shoulder for 6 months, I taught the patient, and the patient did it for 1.5 months on himself, and then he could get all the range of movement. Then suppose if it's a case of lumbar canal stenosis, of course, long standing. So as patient I showed you 1.5 years. The patient, suppose it comes with a cervical neck trauma, there was a patient with paraplegia, and we did it for 7 to 8 months along with some of the panchakarma procedures and the medicine. We could get some of the upper limb range of movement back. I could not make the patient walk. The patient was still in wheelchair, but we could at least get the upper limb movement back. So that was again a long-term treatment. So it depends upon what kind of disease that you are treating. Thank you. But even if the ankle is swollen, and I have done it in many cases, once you have done it in more simpler ones, you will be able to find if the Marma points correctly. And in the edematous condition, after doing the Marma point stimulation, the edema tends to reduce in just a few sittings. Again, you have to check the renal and the cardiac status of ankle edema. Right?
Thank you so much.
Yeah.
Thank you.